Hi everyone. Last week, you could do this, okay? We're in our last week. Finals start, I believe, Thursday of this week. So we'll have a regular week, and then next week we'll have our final. And I'll put everything in writing at the homepage and an announcement, all of that good stuff. All right. So it's this week. It's about consumer health. Short chapter, but pretty important because we're talking about healthcare, doctor's visits, what information can you trust. If you think about COVID-19, there's all kinds of information. Where do you get your information from? Is the information reliable? What's real? What's not real? Trust me, there's a lot of junk out there, right? There are people, I know this sounds horrible, and for me, my naive bubble, right? This idea that some people will take advantage of a catastrophe, right? The idea that some people are like, ooh, opportunity to make a buck. Yes, those people are out there. So, how do you protect yourself, right? How are you a good consumer and specifically for your health? Okay, so let's take a look. Approximately, where do you get your information? Of course, the internet, right? Approximately 75% of the internet users have sought health information online. Okay, there's some great sources, there are some not so great sources. So, knowing the difference, they talk about that in this chapter. Medical errors account for a significant number of deaths in the US, about 250,000. Doctors are people, right? And they can make mistakes, okay? And that's where the malpractice insurance comes in. But okay, so knowing that. About 6.1 million young Americans, adult age 19 to 25, have gained health insurance since 2010. The Affordable Care Act made a huge difference with health insurance, and in this chapter, we'll be talking about that. What's crazy to think, they talk about paying for healthcare, and I have to read this because it's unbelievable and it kind of makes me sick. Okay, I'm just being honest. It says in the United States, we're surrounded by highly advanced medical care at a steep price. Our system is among the most expensive in the world, and our country spends the most on healthcare as a percentage of gross domestic product, GDP. So it's considered a service, kind of like, making something or selling something. But it's like, what? We're selling healthcare? I know that sounds very naive on my part, but it says, according to the nonprofit California Healthcare Foundation, health spending reached nearly $3 trillion in 2014 in the United States, about 9,523 per person. That is staggering, okay? Now, when you think about it, health is so important. Are you going to say, no, I'm not going to pay for that medicine? Are you going to say, no, I'm not going to have that surgery if it's like you have that or you're really highly compromised or you die, right? So it's almost as if you're being held at gunpoint in a way to do that service, okay? So, that's a whole debate, okay? And I don't want to debate that, but what I want to do is to say, this is big business. Some people are making money off of this, okay? GDP, if you've taken economics, gross domestic product, that's the part that makes me a little sick. Because is it our fundamental right to have health care? Is it or isn't it? Okay? That's it. That's all I'm going to say. Okay, moving on. All right. So, consumer health, yeah, okay. An umbrella term encompassing topics related to the purchase and consumption of health related products and services. Because in the end, that's what it is, okay, right now. If you have a headache and you go to the store and buy some, Tylenol or ibuprofen, you're buying something to help you. If you have diabetes and you have to go to the doctor, you're paying for that doctor visit to help you get better for the meantime, right? Or whatever it is. So that's why they say consumer health. So how can you help yourself? Because guess what? No one's going to help you. You have to help yourself first. You're like, Miss Collins, why do you have to be so negative? I'm not being negative, I'm being realistic. No one's going to take care of you better than you will. Okay? Your mom and dad love you more than anything in the world, right? But you have to love yourself. You have to take care of yourself. Okay? So choosing, and this sounds silly now, doesn't it? Choosing self care. But I think I'll say I'm guilty, right? I'm like, I'm too busy. I don't want to take care of this, or I don't want to take, I'll do that later, okay? Well, making yourself a priority is important too, right? And taking care of yourself. And I'm guilty for not doing that, okay? All right. So the whole everything we've been talking about this semester is talking about that actually. Practicing prevention, right? Eating well. Again, I am guilty. Okay, COVID-19 is happening. I'm at home. What am I doing? I'm baking. I'm using sugar and butter. Oh my gosh. Okay, but that's my my therapy. Okay, but that's not good. Okay, so I gotta think about that, because your body, if you think of your body as a machine, it's gonna work optimally if you feed it well. Okay, and so eating nutritiously, exercising, right? You got to work that machine, right? Imagine a car. You got to drive your car. If the car's been sitting in the driveway and you haven't been driving it, the battery's going to die, right? You got to oil your car, maintenance, etc. So eating nutritiously, that's like taking care of your body, exercising, oiling your joints, moving, all of that. Refrain from unhealthy behavior, smoking, excessive drinking. Remember, we started this semester talking about this. Just some regular hygiene, brush, floss your teeth, right? So no rot, no infections. Make sure you get enough sleep. That's where your body heals itself, gets better, keeps stress under control. Yeah, good luck with that. But you can try to manage your situation, where you are and what kind of stress you have. Maintaining good relationships. Oh my gosh, right now, social distancing, but how nice would it be to have those good, healthy relationships? Engage in common sense behaviors like seatbelt, helmet, practice safe sex. So these are ways, they're not the only, yes, these are ways of helping prevention, helping keeping your body at optimal condition. Because if you do that, then you're more likely to be healthy, right? You're more likely to, if there's an infection, your body's ready to fight it. If you fall, your body's probably going to be more likely to get back up, right? Depending on what it is, okay? But trying to maintain that great condition. Finding accurate health information, of course, the internet. The internet has some really great stuff. And actually, in the chapter, there's an awesome, at the end of the chapter, it says the Medical Library Association top 100 list health websites you can trust. Great. Maybe I need to add that in. I'll add that into our in Canvas. The internet, doctors call it Dr. Google, right? So be careful, because there's some junk out there. There's some stuff that might have nothing to do with you, but it's good to get the information, but always look at the source. Where are you getting the information from? So evaluating health information. What's the source? What does the source have at stake? Are we looking at a medical school, or are we looking at a snake oil salesman? Are they trying to sell you something? Is the information or tool supported by facts? Does the information come with a timestamp? Like, how old is it? Is information presented in a balanced manner? Discuss other options. Okay. Does it sound too good to be true? Okay, I hate to say it, but I'm going to say it. Okay, with COVID-19, you hear about people talking. There are people out there trying to sell stuff saying that it's a cure or it's going to help prevent it. Is it backed by science? Is it backed by the scientific method? So, research studies, right? Evidence-based medicine, healthcare. Okay, is the study valid and reliable? So, for example, I put Dr. Anthony Fauci. He's the head. It's not the CDC, but it's a health organization for the government. And this idea of research, how do they have control groups? Do they have experimental groups? Do they have placebos? How detailed? How many participants? Do they have a vested interest or not? These are all important questions. So research, published, study participants, how many people, profiles, what's the study like, okay? Are there conflicts of interest? Like the people who are doing the study, are they selling the vaccine? Are they selling the cure, right? So knowing that information. So what are some options for self-care? Of course, OTC. OTC stands for over-the-counter medications. A lot of people buy over-the-counter medications, which is very, that's good. That's great. It says approximately 80% of US currently take at least one type of medication. More than 40 billion worth of OTC is sold in the US. Approximately 74% of college students take this. Now, on page 356, they talk about taking the medication safely. It is over the counter, and just because it's over the counter does not mean that it can't harm you, okay? You have to read the labels and you need to take it the way it's prescribed. If you don't, it can harm you. For example, ibuprofen. They say take ibuprofen on with food. Why? Because if you take it on an empty stomach, ibuprofen can cause ulcers, okay? So there's different things that you have to be careful of, dosages, etc., etc. Home health test, that's kind of cool. There are pregnancy tests you can take at home. Blood pressure, fertility, cholesterol, blood glucose, colon cancer risk test, HIV test. What? Okay. Now it says see disclaimer in the textbook. What they say about that is you got to be really careful with stuff like this because first of all, you got to read the label. You got to take it right because what if you don't do the test right and you get a false positive or a false negative, and that could lead to risk. Then next, what if I won't say you, what if somebody takes an HIV test and they do it right and they get a positive? If they're home alone, what are they going to do next? Okay, so it's this idea versus if the person had taken it at a doctor's office. Now the doctor's office knows how to direct the person to get health care, okay? So really interesting there. When do you see a doctor? Okay, well, I shouldn't say most people. The book talks about it. They say like most people go to the doctor only when they think they have to go to the doctor, right? Like it's an emergency or whatever. I think both things are true. Some people are like hypochondriacs and go to the doctor all the time. Some people wait too long before they go to the doctor. I remember again with COVID, a woman in Pomona died from COVID and she had a heart attack. She waited too long before going to the hospital. By the time she got there, she had her heart attack, right? So trying to pay attention to your body, okay? So there are specific things they talk about. Again, I love this book because it's short, concise, gets to the point, has great information. All right. So there are checkups. Checkups, preventative care. That's really good, right? Do you go to the dentist? Do you see the eye doctors? Do you get vaccines? You should, because that is going to help your body work at that optimal condition. By working with your health, if you have health insurance. By the way, as a student, we have student health services. You know that they provide a lot of services for you, okay? By working with your healthcare provider to get regular screenings and checkups, you can prevent problems or catch them early when they're often far easier to treat, okay? In the book, there's a table on page 357 that talk about recommended health screenings. So blood pressure, cholesterol, vision, glaucoma, dental, and they talk about who needs it, how often, and comments. So that's really neat. Oh, there it is. Okay, you can see the table, right? Pap test starting age 21 every 3 years, right? So there's screening for cervical cancer, mammogram. Now that has changed, and it's based on science and they learn new things so the recommendations can change. Now, people will sometimes get angry and they're like, they said this and now they're saying that. Well, we're people and we're learning, right? And doctors are people. The medical field, they're made out of people where they learn new things and the recommendations might change. All right, vaccines, tetanus, influenza. Okay, health problems beyond self-care. So what about going to the doctors? When should you go, or what are some signs I got to go? Okay. For sure, you should go. It says health problems beyond self-care, right? Don't ignore severe injury, serious burns, sudden severe pain. Talking about pain, okay? Pain, I know we all hate pain. Well, I guess we don't all hate pain. I shouldn't make that. But, most people hate pain. But what is pain? Pain is really important. It's your body telling you that something is wrong. So if that happens, don't ignore it. You need to go in and find out what's going on. Is it just gas? I know that sounds funny, but gas can be painful. Or is it something more serious? I have a friend, you all don't know, and I'm not saying the name, but this is happening right now in COVID-19 times. She was coughing a lot and her throat is hurting. So she did go to the doctors and she's having issues with her thyroid. So they're doing an ultrasound and checking it, right? So it helps to go in and get things checked. Allergic reactions, reactions to medication, heavy bleeding, of course, difficulty breathing, signs of heart attack, signs of stroke, sudden worsening chronic health condition. So chronic health condition, diabetes, asthma, of course, going in, having the doctor check on that. Vomiting, inability to keep fluids down, painful swallowing, persistent cough, earache. Persistent cough is a really weird one. Sometimes it's signs of something more disease, more, ominous. Persistent cough. Okay. Black or bloody stools. I think we've talked about this, right? Don't ignore that. A feeling that food's stuck in the throat, heartburn, persistent severe abdominal pain, unexplained weight loss. Unexplained weight loss could mean a lot of things too. And remember, we saw that video in class with this lady losing weight and having the shakes, and she's like, "Hey, I'm losing weight." But then, right, there was something wrong with her thyroid. So going in is really important. Severe headache, palpitations, pain, sweat, and swelling in legs, uncommon period, sudden feeling of illness, fever, fever 100 and above, depends on the time, swelling, redness around the eye, moderate, severe abdominal pain. So those are all things to not avoid, okay? The fever part, okay, it depends. Some of us get fevers. I don't say you should go to the doctor right away, but how long do you have the fever? How high is the fever? Then, you might be concerned. Remember, a fever is telling you that there's an infection. Something's going on. Your immune system is fighting something off, okay? So, medicine, how do we treat our bodies? Okay, conventional medicine, so we can think of Western medicine, right? Allopathic Western medicine, based on the use of science, the scientific method. So vaccines, where did vaccines come from? They've gone through a whole rigorous testing. Surgeries, the surgeries that we do, the types of mammograms we do, the pap tests, all these things have gone through testing. There's a whole history of medicine. In the past, medicine was not very scientific. Now it is more scientific. Yay. Okay. Meaning, they have a hypothesis, they have an experiment, they have their results, they have their conclusions to see what is the best way to treat this issue, trying to get to truth, whatever that is. Focuses on physical causes and symptoms, emphasizes physical exams, x-rays, blood test, treatment, focuses on public health, right? So I love this. They show the abbreviations, because sometimes you go to the doctors and you don't know who's who, okay? MD, medical doctor, right? DO, they're also a medical doctor, but they have additional training in osteopathic manipulative treatment, holistic, so trying to look at the whole body. PA, physician's assistants. So they're not a nurse, they're not a doctor, but they can do a lot more than a nurse can, but they're under the license of a doctor. It says licensed health professional who practice under the supervision of a physician, provides broad range of care. So PAs, they can do surgery, right? They can do certain things, but they're always under the doctor, okay? Dentist, DDS. Optometrist, licensed professional who provides vision care. Optometrist, when you go and they check, your vision, versus ophthalmologist. Ophthalmologist is an MD, okay, specifying with eyes. Podiatrist, specifying with feet. Nurse, RN, registered nurse, that would be an AA. So at Chaffey College, for example, we have an RN program. BSN, it's a bachelor's in nursing, okay? So the difference. And so they might have a different scope of practice, but again, they would work with doctors. Nurse practitioner, now it says registered nurse who's undergone additional training can perform some of the care provided by an MD. So a nurse practitioner can have her or his own patients. And there's different types of nurse practitioners. Like there could be nurse practitioners in internal medicine, there could be nurse practitioners in gynecology. There are different types. All right, where can you find conventional healthcare? Student health centers. Again, your student fees pay for that. By the way, at Chaffey, they're still doing a lot of support services, but they're doing it online. I think I'm going to post that so y'all know that. Primary care facilities, nonprofit clinics, retail clinics, urgent care centers, specialist centers, hospitals. So these are all places where you can get this type of care. They talk about details about this in the book. Choosing a provider. That is really difficult. I have to say, like choosing a provider is not very easy. Most of the time, when you're healthy, you don't think about these things. You're like, I'm healthy, it's good. It's when you're not healthy, that's when you think about these things. So, for example, I'll use someone I love. They have back pain, okay? So they have back pain, they have chronic back pain. Okay, so how do they move forward through the system, okay? So, is it a HMO? Is it a PPO? Can you choose the doctor? So first thing in trying to choose a provider or a doctor is this provider accepting new patients? What insurance plan does this office accept? Is the doctor board certified if you're interested in that? How does the office handle lab work? Like sometimes they do lab, for example, Kaiser, they do lab testing there. Versus if you go to another, a doctor's office, they might take the blood and then send it to a lab where they analyze the blood. Is this a group practice? Are there a lot of doctors in that office? Who will care for you if your provider is unavailable? Like I remember when I was pregnant and I had my doctor, okay, but there was no guarantee that my doctor was going to be there when I was having the baby, okay? So did that bother me or not? Is the practice affiliated with any particular hospitals or specialty centers? So for example, with Kaiser has Kaiser Hospital. If you go to just a doctor, it's like, what hospital is he affiliated with or she affiliated with if you get sick and you need to go? Being a smart patient. Talk to your provider, ask questions, take information home with you, follow up with your provider, prevent medical errors. The doctor, the nurse, the PA, whoever it is, they see tons of people. They see hundreds of people. They may remember you, they may not, right? If you're lucky enough that you've had the same doctor forever and they know you, that's one thing. Most of us don't have that. So you have to be your advocate for your health. Don't assume they know certain things. That's where the talking to your provider, asking questions. It's your body. It's okay to ask questions. Take information home with you. Sometimes the doctors have great pamphlets. Follow up if you want to. for example, we're with Kaiser, we can email our doctor. It's kind of really neat. If I'm concerned about something, I could take a picture, upload it, email it to the doctor. In the past, I never had those options, okay? Yes, prescription meds, right? So, again, reading and following the directions. Opioid painkillers, we talked about this, right? Prescription drugs are now the leading cause of overdose deaths. So if it's prescription or if it's over the counter, you have to be very careful with it and follow what the recommended dosages are. All right, what about not Western medicine? What about holistic health, Eastern medicine, okay? So complementary alternative, like going to the chiropractor or getting acupuncture or herbal remedies or whatever. What are those things and are those things credible? Okay. Health practices, traditions, not typically part of conventional Western medicine. So maybe used alone, maybe used in conjunction. It's really kind of cool. In your book, they talk about the research behind some of this, and they talk about what the research is telling us now. Now I have to tell you, there are doctors who do both, right? They haven't. They're an MD. They have their training through Western medicine, but they also have training with alternative medicine, and they use both. So that's kind of really neat. Uh, okay, so herbal supplements, massage therapy, chiropractic, mega vitamins, energy healing, acupuncture. Like, for example, massage. Does massage help? I am very prone to headaches. And I remember, and so I always have ibuprofen with me, okay, just in case. But I remember one time I was at work and all of a sudden I got a headache and I was like in pain. And one of my fellow workers said, "Here, and started rubbing my neck. And literally, my pain started going away. Usually, I don't rely on that because it's like if I have my ibuprofen, I'm taking it. But it really helped. So, for some people, that can be really helpful. So, five major, so whole medical system, mind body medicine, natural products, manipulative body based practices, energy therapies. They talk about these in your book. Be an informed consumer, be aware. Natural does not necessarily mean safe. Okay, learn about safety. This is the table I was talking about. This is on page 363. It's too small. It's really, whoa, I've just made it smaller. It's hard to see. Natural products, description, common use, risks, and then scientific evaluation. Now, I love that. On this section, I'm over it. It says scientific evaluation. So, what has the scientific method shown? So, natural products is the studies have found that these therapies have varying level of usefulness. Physicians say that more research is okay. So, it talks about what does conventional medicine say about it? So I really like that. And it talks about what does the research say. So I really like that too. Whoops. Okay. So look at that because it's really neat. Natural products, okay. Manipulative. Now I know like acupuncture and so on. By the way, like me being a Kaiser patient, Kaiser will pay for chiropractic. Kaiser will pay for acupuncture. So they're saying they recognize it as being therapeutic. Okay. Paying. Now, how do we pay? Right? Do we have insurance? Okay. So there are different types of programs, and this is probably a really important part of this chapter. It starts on page 364 to 365, health discount programs. A system of health discounts given to members. Okay, so if you're in a health group, how does that help? Health insurance, contract between an insurance company and a group. Most college students have health insurance. So you again, as a community college student, you do have access to our health office, right? But also, you might be able to get insurance. They talk about pre-existing conditions. They talk about different types of health insurance, HMO. So Kaiser is an HMO. What that means is you have a group of doctors working and they do a lot of stuff in-house. Okay, like they do their tests, blah 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 blah. It says a type of managed care plan in which most healthcare is funneled through and must be approved by the primary care doctor. Now that too, they will not just do whatever. Your primary care doctor has to see you first, and then they might refer you to a specialist. And even when they do refer you to a specialist, they're probably a Kaiser doctor. Okay, they're within that group. PPO, you get more freedom. You could choose your doctor. So, type of managed care plan in which consumer encouraged to stay within approved network providers but can obtain care outside the network. Okay. POS, it's a HMO, broader list of providers. Mini med plan, managed care for young people. So, there's different options, and with those different options come different price tags. Okay. Cheaper, more expensive. Public programs, Medicaid for people with low income. Okay, so Medicare, that's the federal public insurance program, covers people with long-term disabilities, people who are 65 or older, right? So after a period of time, after 65, Medicare covers your costs, okay? Fee for service, you could pay for that. Health savings account, some people, and flexible spending account, some people use these, right? Like kind of like a savings account for a rainy day, but there's some tax benefits. So some people are interested in that. Not a lot of people do it, but they can. Now, the Affordable Care Act, there is on page 367, it talks about the Affordable Care Act. It's very controversial, okay, politically controversial. In my point of view, for people, and if we're talking about health, it's been good, okay? So, oh, they don't talk more about that. Okay, they in the book on page 367, they talk about the positives of Affordable Care Act. For example, insurance companies can't deny someone coverage because of a pre-existing condition. For example, you could be up to 26 and still be covered under your parents' insurance. For example, women, guarantee coverage for women's health. That women, because women, with pap smears, with mammograms, with all these things, have these other things that men usually don't have. Well, they don't have to pay extra because of that, those preventative measures. So interesting, on page 367, they have information about that. Student health insurance, yeah, some states have that, so we could take a look at that. When you graduate, what happens? Well, you can't get the student health, but you can pay for it, but it costs more. Okay, so they talk about that. Personalized medicine. Okay, this is exciting. Okay, looking at people as individuals, not just lumping everybody into a group, and can we treat people differently, which they already do, but medications, like could medications work differently on this person versus that person versus that? So looking at genetics and looking at like tumors, let's say, maybe this medicine would be better for this tumor than that medicine. So looking at that. So genomics, the study of genomes and their effect. So your DNA, genetic material of any, okay, okay, so looking at that. Looking at family history, looking at your genes, looking at whole genome sequencing. Now, this can be very controversial. For example, the BRCA1 gene, the BRCA2 gene, those genes are responsible for some breast cancers, okay? So if a person inherited that gene, what that means is they're more likely to get breast cancer. Okay, so what does that mean? That means that person should get more preventative care. That person should get more breast exams and keep their regular checkups and all of that. Well, who gets that information? Does the insurance company get that information? And if they get that information, are they going to hike up your rates because of it? Okay, so there's positives and negatives. Okay. To that, They talk about that on pages 370, 371. It says ethical, social, legal implications of genomic advances. There was in the lawmakers in 2008 says U.S. lawmakers enacted the Genetic Information Non-Discrimination Act, GINA. This law strengthens the privacy of personal DNA information and prohibits genetic discrimination in health insurance and employment. So that's good. That's positive. But I'm a little hesitant, okay? But at the same time, it's like it's your health, right? So if we're saying good faith that people are acting on other people's best interest in regards to health, yeah, we can take our chances there. Finally, change yourself, change your world. Personal choices, practice prevention, right? Good health care, right? Good food, good exercise, no smoking, drinking, practicing safe choices like driving and seatbelts and all of that. Make informed choices, learn about stuff and make informed choices. I mean, again, I keep going to COVID-19, well, because that's what's happening right now. So, should you take the hydroxychloroquine, or should you take, or those antiviral medications? Well, what do the health professionals say? What do the studies say? So being engaged about your health care. Find the right care before you need it, right? It's always helpful. I know that kind of sounds really privileged. Like, can you, can't you? But if you can, why not? Don't wait until you need it. Why not look into it and see what your options are? Because if you wait till when you need it, you might be pressed, right, against between a rock and a hard place where you got to just make the choice and it might not be the best choice. Know when you need help, right? So that's talking about going into your doctors. Know how you'll pay. Now, I hate to say this. I know people, family, friends, where healthcare, where the dad had cancer and it ruined the family financially because of their cancer treatment, their health care, for example, their insurance had a cap. I forget what it was. Let's say it's $2 million. $2 million sounds like a lot of money, but when you're talking about healthcare and when you're talking about cancer and when you're talking about he struggled with cancer for seven years, they ran out of money. Like literally, their insurance said, "Well, that's it. We don't cover you anymore." Okay. Well, the Affordable Care Act, again on page 367, says, get sick, stay insured. Imagine you get sick and your insurance company drops you. What? What's the point of insurance? Another thing, no lifetime limits. It says insurers cannot place a lifetime cap on the insurance benefits you receive. So there are some real crucial things. When you think about it, they talk about the fine print. How many people read the fine print? A lot of people don't, right? And here's this idea of the Affordable Care Act trying to protect the consumer, okay? And again, the thing that makes me physically ill is it's not about I feel like it shouldn't be about being a consumer. It should be like a fundamental right, just like breathing oxygen or drinking water is a fundamental right. If we are this society where, we are, what's the word, humane, shouldn't we, and if we are sharing, shouldn't that be part of our fundamental rights? Okay. Okay, so that finishes up this chapter. The last chapter is chapter 15. It's personal safety and injury prevention. You do not have to worry about that chapter. for the final. You don't have to worry about it. It's a good chapter. It talks about injuries like motorcycle accidents. It talks about residential, occupational injuries. It talks about violence. Now, there's a part that is, to me, really important. They talk about intimate partner violence. I think, unfortunately, and again, this is my opinion, okay, but it's an informed opinion, okay. Unfortunately, our society doesn't talk about domestic abuse that much. And, when I was preparing for this lecture, I was talking to my husband and I said, "Oh, honey, like this really bugs me, this is important." And he said, "Well, it's really not part of health." I'm like, how is that not part of health? But I understand what he means. Like diabetes, blood pressure, la la la, that's all part of health. Well, not getting beat is probably part of health too, okay? And when you look at the statistics, it's actually staggering, okay? So I'm going to say it really quickly. It says 1 in 4 women, that's 25%, okay? 1 in 4 women has been the victim of severe physical violence by an intimate partner, right? Versus 1 in 7 men. So women, much more than men. Then nearly 1 in 5 women, that's almost 20%, has been raped versus 1 in 71 men. Women make up 70% of all deaths due to intimate partner violence versus 30% of men. So again, I think it's really important that we talk about this because I think a lot of times people feel ashamed and they don't want to talk about it and they think, what did I do? What did I do wrong? Or they might be trapped in that situation. So in your book on page 390, they talk about the cycle of violence. So tension building, acute battering, and remorse. They talk about victims and they talk about addressing violence and they talk about how to get help, okay? They also, so that's really important. So some of the resources are in chapter 15. They also talk about date rape. And, I think what I'm going to do is, again, for this chapter, I think I'm going to do a link to a video if I can, if we can see it, if it's for free, where it talks about rape on college campuses. The percentage is higher than what you might think, okay? And when you read that or when you see that, you're like, oh my gosh, are there that many men who rape? The answer is no, okay? It's something like 20%, right? The 20%. It doesn't mean that 20% of men rape. No. What it means is what science, what the data shows us, it's not that a lot of men rape. It's the men who rape are repeat offenders. So they'll rape a lot of women, and that's where the number goes up. And that's where, talking about it is important, because if we're going to stop that behavior, if we're going to protect our people, how do we do that? Okay. Sorry, that's just like, to me, that's a fundamental right? The ability to survive without being afraid of being beat, okay? So it has been a pleasure having you in my class. I am so sad that I don't get to see you. I wish you well. The final is going to be next week. I'm going to open it up on Canvas, just like before. I'm going to do like a 3-day window, okay? Where just like before, you have a 3-day window, Monday through Wednesday of finals week, where you take it when you want. But once you start the test, you're committed and you need to finish the test, okay? And the test is going to be on the chapters we've covered since the last test. And I can't remember what numbers they are, but I'll definitely, I'll put them in the announcement. Okay, if you have any questions, concerns, this week I have office hours. Please come and see me. Maybe I'll do a Zoom study session. I think that's a good idea. I'll email you guys for this week. And I wish you well. All right, bye bye.